Chapter 5, Patient and Family Teaching, Pharm, Lecture B, page 54, Motivation. Motivation, you need to know this. A patient must be motivated, have the desire, or seeing a need to learn. Motivation depends on the patient's perception of the need to learn. Educating the patient or client or resident about the disease process improves their motivation to learn tasks that they need to learn and to stay healthy. And yes, I'm going to take a little time. For a student must be motivated to learn. It depends on the student's perception of what they need to learn. Cheat and Quizlet and copying, you will fail. You're setting yourself up for failure. Adult learning, you need to know. Adult learning. Adults learn only what they feel they need to learn, generally. Adults learn best when they have a strong inner motivation to acquire new skill or new knowledge. You also need most adults retain the information taught if they're able to do something with that new knowledge immediately, and this makes so much sense. When you start practicing vital signs and physical assessments, head to toes, and documenting, it will all make more sense, and you will feel more comfortable with that when you get to actually do these skills. So back to what you need. For example, in teaching a patient how to administer insulin, demonstrate the technique, allow time for supervised practice as soon as the patient appears ready. Yes, the teach-back method, they're going to show us that they know how to give that insulin injection correctly. Learning styles and domains of learning. You're going to highlight so much in box 5.2 that I can barely see the words. But at the end of the learning styles and domains of learning, I do have this highlighted. Kinesthetic. These kinesthetic learners learn by doing it themselves. Assessing a patient's learning style helps you discover the best methods to use when you're providing client teaching. So the box 5.2, kinesthetic learners learn by moving, touching, and doing. There are different domains of learning, different domains: cognitive, affective, and psychomotor. The 3 learning domains. There's your SATA. Now within this, cognitive, intellectual activity such as thought, recall, decision-making, and drawing conclusions. So in this domain, the patient uses previous experiences, prior knowledge, and perceptions to give meaning to new information or to modify previous thinking. So see, and under cognitive, beginning in this domain, those 3 are SATA. Affective domain, affective behavior, includes attitudes, feelings, beliefs, and opinions of the patient or caregiver. Psychomotor domain involves learning physical skills like injection of insulin, as I just spoke of, or tasks such as performing a dressing change. Psychomotor, performing a dressing change, learning to do trach care, anything, using medical equipment that you're going to use the stethoscope, blood pressure, anything, that falls in under with that psychomotor domain. Psychomotor looks like, I need to look at this again. There's some 3 SATAs there, so I told you 2, and I'll look at the other one. So, combining teaching skills in the nursing process, FYI, We are in a unique position. Nurses are in very unique positions of delivering health care and educating patients and family members. The empowered patient feels confident that he or she is part of that patient-centered relationship with you, and positive outcomes will occur. A framework for patient teaching, and this is FYI, but we have to have a framework to develop an effective teaching plan. The nursing process gives us a good framework to develop teaching plans. Nursing process, patient teaching for medication information. On page 55, you need this assessment. To develop an effective teaching plan, first determine the patient's needs. Also, you need to know some drugs have simple uses, Some drugs have simple uses, and therefore relatively little patient teaching is needed. For example, applying a non-prescription ointment to the skin. Neomycin. That doesn't take much education, minimal teaching. Other drugs, though, injecting insulin sub-Q, see, that's a whole different ballgame. So that requires detailed information that may need to be given over several days. Yes, very much. I know that makes sense to you. Also, there's an example. A visually impaired patient may be unable to read a label or printed directions supplied by the primary health care provider, pharmacist, or nurse, just showing they may not be able to read a label, visually impaired, and also if they're hearing impaired, just to throw that in, hard of hearing. The abbreviation is all capital HOH, hard of hearing. Sometimes, as I stated, people with different cultures, and they do not speak English as their primary language, an interpreter is needed. Nursing diagnoses. So nursing diagnosis checklist, you need to know deficient knowledge related to the drug regimen, possible adverse reactions, disease process, or other factors. You need to know also, under box 5.3, still in the text, the nursing diagnosis, readiness for enhanced health management, generally describes someone who is successfully managing the medication regimen. Using this nursing diagnosis to enhance the patient's management by teaching the patient possible adverse reactions that could affect their health, and how to manage them or reduce the potential harmful effects. So we use that diagnosis then. You need to know the last paragraph. Deficient knowledge is a nursing diagnosis that may be used when the patient has a deficit in cognitive knowledge or psychomotor skills necessary to administer a medication properly. Now, I don't want you to think, oh, that's the answer. That's always the answer. No. Anything, any medications, any disease process, diets, deficient knowledge would fit many categories. I want to state that. This talking about performing a brown bag medication review, a simple method to identify patients with limited health literacy. You do not need this, but I'm just going to mention this. Ask them to bring all their medications to the clinic or appointment. Ask them to name each medication and explain its purpose and how they take it. Listen to how the client responds to questions about how to take the various medications. Reframe the question if it sounds like the patient may have memorized the instructions. This goes back to motivation for nursing students. Memorizing answers and then just looking through and finding them on the test, that is going to get you in trouble. And I can assure you and promise you that it will. Page 56, planning. You need to know planning begins with the development of a goal and the expected outcome that the nurse will use to measure attainment of that goal. Box 5.4, important info to include in any medication teaching plan. This is not exam material, but this is nurse material. Therapeutic response that's expected from the drug. Adverse reactions to expect when taking the drug. Adverse reactions that will occur to report to the doctor or the nurse. Dosage and route. Any special considerations or precautions with that drug. Additional education regarding special instructions, techniques for giving injections, applying topical patches, instilling eye drops. And do you remember the abbreviation for drops? Concept mastery alert. This is not for exam purposes. We need to first determine the goal of our teaching plan. An effective plan starts with a goal, and the remaining options, those who the teaching plan is for, the education level of the patient, and who the caregivers will be, are addressed also in light of this goal. Selecting relevant information. You can highlight this because I've stated this already for class. The second paragraph, it is important to remember that repetition enhances learning. I said we are a repetitive family. We're going to repeat and repeat and repeat until you can regurgitate it out without even thinking about it. Implementation is the actual performance of the interventions that have been identified in the teaching plan, putting the plan into action, and this is FYI. When you take the time to develop a therapeutic relationship, when you take the time, the patient and family has confidence in you and more confidence in whatever information that you are giving. Basic considerations when developing a drug teaching plan, page 57. This is FYI for exam purposes, it looks like, but all patients should understand the following. Take with a full 8-ounce glass of water, if that be the case. Do not crush or chew. They never crush or chew enteric-coated tablets or capsules. They must be swallowed whole. Same dose, same time. Take all of it. We need to go into depth on that. Take every bit of for example, the antibiotic, whatever it is, ordered BID for 10 days. We need to tell them at 8 a.m. and at 8 p.m. you will take one of these capsules every day, or this tablet every day for 10 days. And if you need to, use a calendar to mark it off. If you feel better on the 8th day, don't save those last 4 tablets in case you get sick again, because this goes back to when you first started here, the 1st of September. It can cause antibiotic resistant bacteria to occur. When to call the primary health care provider. Do not change or add a dose. Tell all your providers, for example, their prescription and non-prescription meds and herbal meds. Keep a list of all medications, prescriptions, non-prescription. Report any differences that they notice when they're getting refills. Any colors in pills, or the size is different, the shape. Resources to learn more. The World Wide Web. And this is very true. I mentioned this early on. You need to know this. As a general rule, sites ending with .gov, .edu, or .org are reputable. Wiki anything is not. So you need to know those sites. You can highlight that. They should wear a medical alert bracelet depending on their allergy, their whatever it may be. If they're congestive heart failure, just so many different reasons someone would wear a medical alert bracelet. If they're on anticoagulants, steroids, adverse drug effects, you can see that. Family members, we need to tell them never take another person's medication. Tell your family, all family members or relatives are aware of all drugs that they're taking. All drugs must be kept out of reach of children and pets and clients with impaired cognitive ability. Always, always. Keep them locked. Do not keep them in a purse. This concludes Lecture B.